Hi everybody. So this is the only way that I can say hello to you all and to try and keep you motivated for all of your oral hygiene, your good diet, basically looking after, being responsible for your own oral health at home. I'm also going to go over a few little tips on how to do maybe a temporary filling and refix a crown if you feel confident enough. Now, the first thing I need to say is that at the end of this video, there will be a link to how to access all the legal things associated with dentistry and the coronavirus crisis. Basically, NHS England has said that we cannot see patients face to face for consultations. That is obviously for your safety, as well as for my own and for my staff. Believe me, we find this just as frustrating and upsetting as you. We are all feeling a little bit lost. We are offering from 8:30 until 4:30, 7 days a week. There will be a qualified member of staff answering the phones to triage, to advise, and then you can get a call back from a dentist if you're having any serious dental problems. You're not on your own. Whitegates is still here. We're just not allowed to actually physically touch you at the moment. So, starting from the basics, everybody, please remember brushing twice a day, using your electric toothbrushes. If your electric toothbrush breaks, please get a new one. Don't just resort to, oh, this will do until the dentist is open, because we are not sure yet when we can physically do things. Physically be face to face with patients, and even when we can, we suspect it will be only for emergency things such as scale and polishers, fillings, anything involving a drill or a scaler with water. I don't think we'll be able to use for a long time because it's an aerosol, and aerosols are like big sneezers in a surgery. Our staff are very good at cross-infection control, of course they are, but having a big sneeze when coronavirus is as rife as it is at the moment is just a no-no. So please listen to this video and really look after your own teeth and gums. Okay, so first of all, the brushing, twice a day, 2 minutes. Really make sure you're getting all the way to the back, right into the cheek, under the tongue, all the way around the palate, into all the nooks and crannies. Anywhere that your teeth feel furry, make sure you brush there. Everyone who knows me knows that I am always going to tell you to use your TPs. You can ring us anytime if you've forgotten what size you need for your mouth. Your TPs, your interdentals, or Wisdom ones, which are, these look a bit scruffy because they're my own. Wisdom interdentals as well, very good. To use in between the teeth, where the teeth meet and the gum comes down, and that area collects bacteria as well, so you must use those at least once a day. If you get food trapped, use one. Don't use toothpicks, use one of these TPs or an interdental. It will keep your gums healthy. We need your gums to stay healthy, otherwise the teeth will get wobbly, the bone will recede and the teeth will get wobbly, and you will lose teeth prematurely. If you're worried about any gum infections or your gums are getting sore, Colgate toothpaste is fantastic. It doesn't taste the best, but it really will help. It has everything you need for cavity protection, but it also really helps maintain gum health. So that's an excellent one to use every day. Also, the Colgate daily mouthwash. If you're worried about your gums, get some of this, fantastic. It won't stain your teeth, it won't give you a bad taste in your mouth. If your gums are really bleeding and you're really worried about them, first of all, give us a ring and ask for advice. But you can use the full strength Colgate. Now, this stuff will stain your teeth, okay? So don't use it as a daily mouthwash just because, just as a preventative. It isn't a preventative, this is the preventative. This is to treat really poorly bleeding gums, but please ring us for advice. We will be here 8:30 till 4:30, 7 days a week. If your teeth are particularly sensitive, Sensodyne toothpaste is excellent. using it morning and night. Spit, don't rinse afterwards. That applies to all toothpastes. You can get various different ones. This is a very good one, Repair and Protect. And if it's a really sensitive spot, you can actually rub some of the toothpaste onto the tooth. Keep rubbing it in, massaging it in a bit like a cream, and it will help. The one I use is Colgate Total. I like it. Makes my mouth feel really fresh. But even I've had a bit of bleeding gums, and I've had to really go at it with my interdental brushes in the areas that bleed. If it bleeds, clean it more. It's like any wound. If it bleeds, just gently clean it more. But if you're worried, ring us. Okay, so now we're going to go on to if you've lost a crown. Okay, Donna kindly dug out some crowns from our dead crown bin, which look very attractive here. Now, if your crown looks like this and is empty on the inside, and inside your mouth you've got a stub of tooth, and you can physically put the crown back on, bite together, and it all feels okay, then you can use this temporary filling kit. It's like a paste here. Comes in like a little paste, and you just get a small amount out. It's quite squishy. Squish it into the crown. Make sure your crown is going back on and it's not the wrong way around, because if you fix it the wrong way around, we're going to have real problems. So make sure you've tried it in and out. You can bite together properly. Put the temporary filling material into it and bite hard onto it, so you're really biting firmly. Wipe off any extra with a cotton bud and keep your teeth together. This stuff takes 2 to 3 hours to set fully, so just don't eat or drink anything if you're refixing a crown. Other crowns come on posts. Now this is obviously a dead one. If you've got a post and it goes straight back into the hole and there is no pain, and it's just comes straight out and you've just lost it, and it goes straight back in, you can bite together, it's not wobbling all over the place, try and put a little bit of the paste into the hole and push it back in. Post crowns are a bit more tricky to fit. If you're at all worried about crowns, first of all, ring us for advice. But secondly, this actually came with the temporary filling kit. It's just a little pot. So, you know, if in doubt, put your crown in the little pot or in a safe place. Keep it to one side. Don't lose it. And then when we are allowed to see you face to face, we'll be able to assess it properly about whether it can go back in or not. If you can't refix a crown, you're going to ring us, you're going to get advice anyway, but just keep it really clean. And if it's sensitive, get yourself a sensitive toothpaste and just rub that onto the area. Okay, now in terms of putting a temporary filling back in, now this is if a chunk of tooth or a chunk of filling has just come out. You haven't got raging pain or anything like that, but you're missing a bit. You think, oh goodness, I've got this hole in my tooth. Straight away, you need to get a temporary filling kit. At the end of this video, we've got a photograph of everything I've used here, and this kit is from Dentec. There are lots of different temporary filling kits out there. This is just the one that I could get from the chemist. So if you have a hole in your tooth that is not giving you extreme pain, if you're having extreme pain, you must not fill it, you must ring us. But if it isn't really hurting, it's just a bit sensitive, then I'd like you to, I'm going to explain first, and I'm going to show you how to do it. It's very difficult to talk when you've got stuff in your mouth. So first of all, get a little bit out, about that size, so half a pea size at first, because you can always put more in. You want to dry the area and clean any extra food out. So if it's a hole in a bottom tooth, really clean with a cotton bud, clean until the cotton bud comes away with no bits on it or anything like that. There is a pot of something called eugenol here, which is very, very good. Smells extremely strong, but it's very, very good for helping to settle down inflamed nerves or anything that feels sore, but it must only be used on a tooth. If you get it onto your cheek or your tongue, it will burn it. So you must be very, very careful. Now, they've advised in the instructions to put a bit of this on the end of a cotton bud and clean the cavity before you put the temporary filling material in, okay? The way to keep the area really, really dry, I've just used some cotton pads here. You could use a makeup pad, or even just cotton wool stuffed in the side, but remember your mouth's full of saliva. So say if it was a bottom tooth, the thing that you need to do is keep it dry. So you must shove this into your cheek, push it down. You've got quite a lot of space there. I'm just going to ruin my lip gloss. And then also, don't forget the tongue side. That will keep the tooth dry, so that you can clean round with the eugenol and then put your temporary filling in, squish it down with your finger. If a small bit you think, oh, that's not going to fill it, just get another small bit and add to the top. Squish it right down. It does come with a tool here, which is a little ball on the end. You can use that if you want, but honestly, just a clean hand, a really clean hand. Hopefully we've all got really clean hands at the moment. So really squish it down, and if any extra comes off the edges, don't worry, because it doesn't set immediately. With your cotton still either side of the tooth, I want you to bite together really firmly on your back teeth and rub from side to side, grinding the tooth, so that I'm sure many of you remember when I've got you to do a filling, I get you to do that, rub from side to side. It makes sure that the filling is in your bite. If loads comes off at the side, just gently scrape it away with a cotton bud, or even with your nail, just take off that extra bit. But predominantly, you just want to fill that hole so it doesn't get full of bacteria and food. So, in a nutshell, that's your basic first aid for teeth. The main thing is just to look after your mouths. You must. I'm asking you to do not 100% effort, 1000% effort to work with me here, because I can't do it for you at the moment. When you get back, I may not even be able to do a scale for you. You know, it may just be patching teeth up until we get more advice on corona and safe treatment of between dentists and patients. Now, if you have severe toothache, first of all, you're going to ring us on 327 275 between 8:30 and 4:30. Someone will always answer the phone. A dentist will ring you back if it is appropriate. They will then advise you if you have swelling, severe pain, you're really worried about something, bleeding, anything at all like that, any patches in your mouth that you're worried about, you must ring us. We are here, we are working. We just can't actually physically see you. It's very strange doing dentistry on the phone, but it's, you know, we are here. Everyone is here. Everyone wants to help you. And we are all thinking about you. So severe pain, I'm not going to go over here because you will actually be talking directly with one of the dentists. Obviously I'm triaging, as are my colleagues. There is an urgent dental centre. The only thing it can offer at the moment are extractions or dealing with huge swellings and things like that, real emergency stuff. But don't be scared to ring us. We're here to help you. We're here to advise you. So, in a nutshell, that's it. Obviously, it's just all about keeping everything clean. Don't eat toffees. Don't eat too much rubbish. Really, please keep yourselves safe. We want each and every one of you back again. We want to, we won't be hugging you for a while, but we will, you know, we will love to see all of your faces. I'm missing my girls. I'm missing all of you. Yeah, stay safe, everybody. All right, lots of love.